Okay, good morning. Thank you for joining us today. Today is World Day for Safety and Health at Work 2021. We'll be focusing mainly on creating resilient OSH, which is the Occupational Safety and Health Systems, through awareness. Today, we're having this come as a kind complement of Strategic Recruitment Solutions, Inc., and Symmetry Brokerage and Logistics. Now, who are these companies? Strategic Recruitment Solutions, Inc., we are a recruitment company, 100% Guyanese owned, and a female owned company. We also are the sister company to Symmetry Brokerage and Logistics Services. We offer, as the name suggests, brokerage and logistics to not only Guyanese, but anywhere around the world. So if you'd like to have those services, feel free to reach out to us. I'm your moderator. My name is Holly Prasad. I'm the HR for Strategic Recruitment. And we will be having our first speaker, who is Dr. Gravesandi. He was a medical doctor and then decided his passion is health and safety. So he had transitioned into that after a year of various certification in the occupational safety and health arena. And so he will be speaking to us today on creating resilient OSH systems through awareness. Dr. Gravesandi.
Thank you, Holly. So good morning, everyone. So I can go into my slides. So the theme for this year focuses mainly on leveraging elements of an occupational health and safety as set out by the Promotional Framework for Occupational Health and Safety Convention. So this was a convention held in 2006 by the International Labour Organization. So usually a convention would mean that member states would have to sign on and adhere to the outcomes or the outputs from this convention. So, Guyana, being a member state, had to implement some of these elements of this convention into its national system after 2006. But in order to give you a good idea of what that means, what that is, I will go through the history of what exists as occupational health and safety in Guyana. So it started in 1995 with Ordinance 46 of 1995. This was um, basically a law from the when Guyana was British Guyana still. So that governed accidents and occupational diseases. That's the first element. Then there was the establishment of a tripartite committee in 1993, along with a National Advisory Council on Occupational Health and Safety. So in 1993, they drafted the first national policy, which was then sanctioned in Parliament in November of 1993. So for a while, that uh, was just a first draft, and then in 1996, they revised the second draft and adopted the OSH Act. This became the OSH Act in October of 1997. So for some time past, where not much happened on in the scene as it relates to occupational health and safety, then there was the convention that I just spoke about. From that convention, we would have implemented some of that, some of those elements, but it didn't become law until 2009. So what happened there is the act that was from before 1997 uh, was reformed and let's say refreshed with the elements of the convention, and that became law which is chapter 9906 on the 28th of May. So for a long time, you can see there from 2009 to 2018, not much was being done. In 2018, the Ministry of Social Protection finished their National Policy on Occupational Health and Safety, which today is what guides any action or any program that is being related to occupational health and safety. So that policy document is a very small book which outlines what outcomes basically, essentially, that we look forward to having from implementation of this policy. And you can see some of the points here where we're looking for increased productivity in workplaces as a result of a structured approach to occupational health and safety. Of course, we're looking to decrease accidents, incidents, diseases, also absenteeism resulting from any occupational health and safety issues. One here is improved morale. You don't see a lot of this being mentioned, but improved morale resulting from improved work environment and safety systems. Also increased compliance with the Act and other relevant legislation. We want to encourage workplace health and safety culture rather than just stick to compliance. We want to build a culture where employees and employers as the same have it ingrained in the system to think about health and safety first. We want to improve capacity to deal with OSH issues, especially in the emerging oil and gas sector. And then to improve that capacity, you want to work with schools and institutions and other agencies to develop a curriculum to integrate health and safety into their programs, because that is going to be a big part of building capacity. So now that you know some of what the outcomes we're looking to expect, I will go into what the national framework, the structure, the existing structure is. I'm going through all of this so that when I start to speak about what measures there are for specifically COVID, because that's what this presentation is supposed to focus on, so you understand what elements I'm drawing from as I speak. So the governing body for occupational health and safety in Guyana is the Ministry of Social Protection. That's the governing agencies. This agency, this body is guided with information and input and advice from the four bodies you see underneath in this chart. So the National Advisory Council for Occupational Health and Safety is, out of these bodies, the principal body that gives advice. As you can see, it's made up of a number of different agencies nationally, which would include Ministry of Agriculture, for example, NIS, University of Guyana, and the Labor Movement. So these bodies would come together and advise the Ministry of Social Protection on what acts to take, any policy revisions that may need to take place, and how to implement their policies. They also help with the implementation of the policies by doing inspections and compliance inspections and follow up with that. So there is also the workers' representation. So there's representative organizations of workers, which is the Guyana Trade Union and the Federation of Independent Trade Unions in Guyana. So that is how actual employees and workers get input. So they can give input to these unions, and these would represent them at the Ministry of Social Protection. So there are also high-risk sectors, Ministry of Natural Resources, and other agencies associated with them. You can see here GGMC, Environmental Protection Agency, and the Forestry Commission. This is so because a lot of risks are associated with forestry works, and mining works. So these are classed as high-risk sectors, and they have an arm that can reach the Ministry of Social Protection and advise them on any action that they see that might help improve the system. So you also have other agencies not specifically mentioned, which would be Civil Aviation, MARAD, and Mayor and City Council. So yeah, so this is the basic structure of what exists. And now I will move into some of the measures that are being used nationally, just in brief, because the meat of the matter is just to explain what our companies are doing and basically shed light and raise awareness of these measures, because knowing that these national measures exist is a big part of the awareness campaign so that people can make use of these elements. And that is essentially the theme of this day, this International Day, this World Day, to raise awareness so that you would have a resilient occupational health and safety system. So there is the National Health Emergency Operations Center that was created to deal with any pandemic or any diseases that will be classed as pandemic and rapidly spreading. So they have the staff and the system framework set up to deal with this emergency, this crisis. There is the dashboard, which is a valuable piece of information, a valuable tool to give you information on the status of where we are, how rapidly things are spreading. And because they disaggregate the information by regions, you can see hotspots and you can see where you need to take specific measures. That is both from a governance standpoint, as in these governing bodies, the National Operations Center can look at this information and say, okay, we can tailor action based on the information. And we as public citizens can say, okay, yes, things are bad here or things are better here, and we can act accordingly. There is the hotline. This is a very important tool because without this hotline, you would have everyone rushing to hospitals. So the hotline gives us the opportunity to stay at home and get help via telemedicine, basically. So there's also screening done at international ports, the airports. Screening is very important because you can try to figure out with a reasonable amount of accuracy any suspected or probable cases. That is the idea behind screening. And those that do show symptoms and have been in contact with positive cases can be tested. So the government does have a testing facility in a national reference lab that offers PCR testing. So this is probably one of the most important, or arguably one of the most important elements in terms of the national measures. And then there is the quarantine and isolation facilities that can be used for people who were not comfortable staying at home and being around their families, or if your facilities don't permit for you to be isolated, you can have you can opt for quarantine or isolation at a government facility. There's also vaccines that are being given out. We started with the most high risk populations, which would be the elderly, and then we scaled that down to a younger population. A big tool here, a big measure that is not mentioned, not publicized enough, in my personal opinion, is the Extraordinary Gazette, produced in February of this year. This has all the measures that should and must be taken. We should say must, because it's basically an extension of the law. And in this gazette, they also explain different types of legal action that can be taken for persons that are not adherent to these measures, which includes curfew, social distancing, public transport, and a whole host of information. So this is a good resource to take a look at. And then there is preventative ad campaigns. You will see billboards, you will hear radio programs, and see television ads that are targeted to raise awareness on safe measures to take and how to protect yourself. So from this, I will move into some of the things that we are doing here in terms of setting up a system structure that helps to prevent the spread of COVID at work. Um, so I think all of us can learn from each other's companies. Um, we take an effort here to learn and move forward and implement things that are working. So between the sister companies, because we operate out of the same building, we for a period of time had everyone worked at home. These were the things where, um, I guess, at their peak, we opted for a system where everyone was working from home from their various devices, with only a few instances where people would come into the office. And as we moved back to coming into the office, we still have some measures in place to restrict the amount of people in the office. For example, we're not taking in-person client meetings. We're doing meetings with clients virtually. And even if we have a meeting, like an internal meeting with staff, we're still exercising social distancing. On entry of the building, there is a sanitization station with a thermometer and a temperature sheet so that we can have our own little screening tool at the workplace. So we could try to capture any symptoms early so we can ask persons to, or we can grant persons time off for testing and quarantine and isolation. So throughout the building, there's numerous sanitization stations. It would be, I would say, at every other door, office door, there is a hand sanitizer available for use. There are several sinks available that you can actually wash your hand. That is between the two kitchen areas and the two washrooms. So there's about 4 to 6 different sinks available for hand washing. We also provide face masks, and like I said before, we give time off for those people who would request testing and isolation. So a part of our system is information, using information and technology. So in our meetings, specifically the weekly ones, we will go through the COVID dashboard. We make use of the tools provided by the government. So this is one of the tools that we are leveraging. So that's the whole point of using elements or leveraging elements of the convention. So using that dashboard on a weekly basis, we keep our staff aware of what is going on. Again, we have different things in that meeting. One of them is the HR moments, where our HR manager can go through different topics of human resource aspects, and one of that aspect is how employees would react to COVID from a mental health standpoint. The HR can speak on those, can use that opportunity to speak a bit on that and how they interact with each other regarding appropriate office behavior and stuff like that. There is also safety moments where we can speak about the different measures. We would go through things like hand washing and social distancing. We use these opportunities or these allotted times, because these are fixed time slots in our meetings, to speak about these things that can raise awareness and give information to the employees. Again, there is another learning point where, again, we can plug information in about COVID and preventative measures and safety measures that are outside of COVID. And employee voice, I think this was a good initiative for us to give the employee the power to speak on what they're thinking. It is a great mental health tool and fosters good communication. So that being said, you can see that there is a lot of focus here on um, how the relationship between employer and employee is built, and that helps to disseminate information in a bidirectional way, which is a healthy thing, specifically when it comes to spreading information about COVID preventative measures. So we also have recently started a process improvement um, process where we will be analyzing all of what we're speaking about here and trying to make steps forward to see how we can better our system and make it more resilient. And then finally, there is the use of technology and innovation. So we're trying to in you make use of technology where we're having virtual meetings and we're trying to automate certain aspects of work so that there is less possibility of spreading the virus. And yeah, so like I was saying, the International Labour Organization wants to take this opportunity, this day, to raise awareness and stimulate dialogue on the importance of creating resilient health and safety systems, which would draw both from regional and country examples in mitigating and preventing the spread of COVID-19, which is basically what this presentation was about. The example of what measures are there nationally and what measures we are taking as sister companies. So as the takeaway, as the ending point of my presentation, so there's a suggestion for national improvement where I would suggest that we would suggest that there be an increase in the publicity of the national program. Because if you increase this, you will not only would you build awareness, but you begin to shift the mindset of the population to shift to a culture of health and safety. Because if you begin to speak about it, people become aware that yes, there is a system for health and safety in Guyana. It may need developing, and this this act of publicizing our program will force us to actually build capacity, whether it be HR and infrastructure, because we're not going to want to publicize something that is not fit for the purpose. So it forces us to build capacity so that we be proud to say, okay, yes, this is our national program and this is what it is capable of. And it also shows international organizations that are operating offshore that we can provide competent local content, because these companies would look for people that can operate in a safe and healthy manner. And this will show them that we have the capability of doing that. So yes, increase publicity of the national program, and that will be the takeaway point from my presentation. Thank you guys for your attention, and I pass you back to our moderator.
Thank you, Dr. Gravesande. Very informative stuff. For those of you who are attending, feel free to type in your questions in the chat box, and we will be sure to answer those as much as we can at the end of the presentation. If you're unable to do so at this time, this will be posted to our Facebook page, and when it's done, you can also choose to have your questions stated there, and we will be sure to respond to you if you have any concerns or questions as it relates to creating resilient OSH systems through awareness. Dr. Gravesande, I noted, and I had to smile when you mentioned not many persons look at improved employee morale resulting from an improved working environment. But as HR, I can honestly say that this is a core point to look at for employees, because it takes just have a vivid imagination if you're walking into a company that the stairs are crooked, or there's a possibility that while going up or down the stairs you could fall through from the top to the bottom. That really scares an employee and decreases the morale of that employee. So I'm glad you shared on that, and employers need to be very aware that not only are the employees coming to do a job, but you need to have a safe environment for them to do so. They need to feel that they are safe. And this not only has to do with the infrastructure, but as we are in the COVID-19 situation as it is right now, everyone wants to feel safe. And we thank you for bringing those points out. For people who are into the history of how things occur, Dr. Graves-Andy touched on that, and I do appreciate it. I particularly enjoyed looking at the chart, sorry. So I will be checking with you to get a copy of that, Dr. Graves-Andy, for sure. So again, thank you. Our next speaker is Ms. Bonica Gordon. She is just a few weeks shy of 2 years with us as our QHSE officer. She moved to us from the Georgetown Chamber of Commerce, where she was an administrative assistant for approximately 2 years. And we've had the pleasure of having her on board as our QHSE officer. She will be speaking to us on the emerging risks at work with personal security. So, Bonica, you have the floor.
Thank you very much, Holly. Hi, good morning to everybody. So my presentation today will be on emerging risks at work, personal security for World Day for Safety and Health at Work 2021. So I just want to start with a short quote about personal safety, which says, "Personal safety is just that. It's personal. You are the only one who can ultimately keep yourself safe. It starts with knowing that your intuition about people and situations is a brilliant guardian." So I just want to give a little bit of context into what the ILO identified as some of the emerging risks which may be caused by technical innovation or by social or organizational changes in the workplace. And some of these can be new technologies and production processes, for example, nanotechnology, biotechnology, new working conditions such as higher workloads, work intensification from downsizing, as we would have probably seen and experienced during the pandemic, poor conditions associated with migration for work, and of course, jobs in the informal economy. Also, there are emerging forms of employment such as self-employment, outsourcing, and temporary contracts. There may be a few more widely recognized contexts that we know, for example, the ergonomic risks of musculoskeletal disorders. And these may or may not in research be influenced by changes in perception about the importance of certain risk factors, such as the psychosocial factors on work-related stress. So just a little information on the new patterns of prevention. So there are 4 new patterns of preventions that were identified by the ILO, those being the new approaches to knowledge sharing. So the need to share information essentially about emerging risks is a vital need. at both national and international level. So the pace of global socioeconomic development over the past 2 decades has brought about a lot of technical progress in terms of research, which leads to better knowledge sharing concerning risk management. And of course, the wide accessibility of the internet and other communications has facilitated knowledge sharing on a wide scale. For example, the study of nanomaterials illustrate the importance of knowledge sharing in terms of development and application processes, and of course, the identification and assessment of associated hazards and risks, which need to be considered and communicated. The second pattern of prevention would be risk assessment and risk management. Assessing and establishing preventative measures is detrimental, especially for risks in the future, which are expected to be part of complex processes due to many diverse factors. So traditional prevention and control tools are still very effective, but only if they are applied correctly. And those can be applied to only well-known hazards in order to be effective. So some of those hazards and risks could be from hazardous chemicals, machinery and tools, of course, manual handling, and biological agents. However, they need to be complemented by strategies and tools designed to anticipate and evaluate, and of course, control new and emerging risks from the changes in the work environment globally. Third would be the health and safety promotion of the workplace. This I feel is very important in terms of our local development, as Guyana is on the path of adapting to a work safety culture, which is something we did not necessarily see in our industries in the past. So this is a global trend essentially to integrate general health and safety promotion programs, OSH programs specifically, as an additional element to complement any traditional programs that businesses may have to, of course, encourage to build and promote healthy behavior, especially in relation to mental health and task management. And of course, our last pattern of prevention, promoting a national preventative safety and health culture. We would have seen the Ministry of Labor recently embark on a month-long set of activities which would have fostered the building and maintenance of a preventative safety and health culture nationally, to increase essentially general awareness, knowledge, and understanding of hazards and risks across various industries. Of course, the progressive development of these programs will have a significant cultural impact, and of course, it will strengthen national OSH capabilities and capacities, as well as mobilize national and international resources. So just a little information from the Ministry of Labor as it relates to employers' responsibility regarding the safety and health of workers in the workplace. So of course, the legal responsibility for safe working condition rests with the employer. Implementation of favorable conditions and of course adapting work to the needs of the employee is of utmost importance. And this essentially has an effect on three things: workers' motivation, their dedication to produce work of high standards of efficiency and quality, and of course it helps to prevent diseases, disabilities, and early retirement. So what are these responsibilities? So there are 10 listed responsibilities in our National Policy for Health and Safety, which was created and reviewed in 2018. And these are to ensure that the business has a written policy on safety and health at work, and of course, a plan to implement the policy. To ensure that the employer implements risk assessment and mitigation practices to identify the hazards, of course, who might be harmed, how, and to evaluate the risk and implement measures to control the risk. Of course, to ensure the responsibilities of health and safety are detailed in job descriptions and performance review. You can't keep safe if you don't know what you're expected to do to be safe. Of course, make provisions for employment, for pre-employment and periodic medical examinations for employees when required by a regulatory authority, to ensure that employees are appropriately trained in the procedures and precautions that ought to be taken to prevent occupational injuries and illnesses, emphasizing compliance, of course, with the standards and conformance with departmental policies, procedures, and best practices. Maintain a culture of workplace safety and health at work, including personal accountability, by developing and implementing systems to encourage employees to adopt this policy into practice, and report, of course, any unsafe concerns or situations to management in ensuring that joint workplace safety and health committees are established. And ensure, as far as reasonably practicable, that workplace violence, bullying, sexual harassment, and other forms of discrimination based on gender and sexual orientation are eliminated. To integrate OSH principles in the overall planning and decision-making process of the company. Most important, to train internal emergency staff who are capable of administering first aid and capable of fighting simple fires, know how to evacuate people from the building quickly and safely. And last but not least, to comply with the requirements of Occupational Health and Safety Act and supporting regulations made therein. So moving on to personal security. So people often work in demanding roles and extreme conditions. They may have, or there may be, many different hazards to manage, whether you're working in an offshore location, in construction, in the office, out on the road, in the remote locations, etc. Whatever you do, you should always ensure that you can operate safely before you start to work. Everyone has an important part to play in making sure that your workplace is a safer place to work and in keeping yourself safe. You should take personal responsibility in 3 areas. The first one, to comply with all the safety rules and regulations in work, to intervene to prevent unsafe conditions, and to respect fellow workers and the communities in which you work. So in personal security, you should ask yourself essentially 3 questions. You ask yourself, when am I most at risk? If you sit and think about it for a second, you go through your workday without wondering, have I been at risk today? Did I put anybody at risk today? Some situations where people find themselves most at risk at work are when they handle money. So cashiers, for example, some persons in the accounting sections are constantly at risk. When you provide care to people who are ill, on medication, in a panic, or afraid of what might happen to them, especially in emergency services. You're most at risk when you deal with people who have a great deal of anger or feelings of failure. For instance, a disgruntled employee, a disgruntled co-worker, you find that you're greater at risk when persons are angry. You're not quite sure how they will lash out, which puts you at risk. You're most at risk when you face friends and family of employees or clients who are anxious, angry, afraid, or who feel that they cannot cope with large bureaucracy such as hospital or business from which they are seeking help. You find there are situations where you may not be able to essentially control what is happening, and persons may see it as bureaucracy. You have your rules to follow, which in turn can either make them anxious or angry or unable to cope with the situation, causing them to lash out at you. You're most at risk when you enforce rules or regulations. This is specifically targeted at management and, of course, persons on health and safety committees whose responsibility it is to ensure that workers work safe at all times. You are most at risk when you provide an essential service or benefit, or, of course, have the power to withdraw it. You're most at risk when you deal with persons who are intoxicated or under the influence of drugs and are in situations when you represent authority. You are also most at risk when you deal with chemicals or hazardous materials, or in cases when you're doing manual handling, hard labor, you're working in remote locations where communication is at an all-time low, and of course access to people and resources are hard to come by. The second question you should of course ask yourself would be, if I don't feel safe at work, what can I do about it? So your employer is responsible for your safety at work. This includes essentially taking action to prevent violent, abusive, and threatening behavior from customers, clients, fellow workers, and the general public. If you are attacked, you can and should expect support from your employer. If you don't feel safe at work, you have the absolute right to raise this with your safety rep, your supervisor, or management. At the same time, you should be thinking carefully about the risks you face at work. Diane Lamplaugh, who founded the Susie Lamplaugh Trust after her daughter was abducted in 1986, said, "The only way to enable someone to be safe is for them to decide to be safe for themselves, to ask questions of themselves such as, what should I do in a situation? Or if this should happen, then what should I do? And to, of course, incorporate practicing the if this, then what? If A happens, then what happens? If B happens, then what should happen?" So practice the if this, then what scenarios until they become second nature, so that if a situation pops up, you're able to respond immediately. And of course, knowing your way around gives you confidence. It changes behavior and makes you less likely to be an easy target. Of course, violence and abuse at work may be unpredictable, but it is definitely preventable. And last but not least, how can I improve personal safety at work? In order to do so, you can look at safety from 2 points. You can look at it from the point of avoidance, staying out of danger, and from the point of self-defense, getting yourself out of danger. So avoidance. The best way to avoid a dangerous situation is through awareness. Be aware of your situation, your surroundings at all times. Know who is near you and who is moving toward you. And situational awareness. Being aware of your environment and of any potential or real risks or threat that might be present is the first and foremost important key of personal safety and security. It is always better to evade any hostile and dangerous situation by any means possible. There is nothing wrong from running from a risk or threat if possible. Take time out to think about your personal safety. Take a couple minutes in the day to think about your daily routine and how much you notice around you when you're essentially carrying out your daily routines. If you're driving to work daily, do you take time to notice if anybody has been following you for a specific period of time? Do you take time to notice if anyone essentially always drives the same route at you, or if you're in slow moving traffic? Is your vehicle locked? Are your windows rolled up? Just take a little time out daily to think about your personal safety and security. Make a list of the hazardous or safety situations where you have felt at risk, were harmed during the course of your work. For each occasion, ask yourself these questions. What happened and where? How did you react? Did you tell anyone? If not, why not? Ask yourself, could it happen again? What would I do if it happens next time? If it's a case where you've suffered an abusive or violent incident at work, you should ensure that you talk to someone. You might blame yourself, feel sorry for your client or your co-worker, or you may work in an organization where safety isn't taken seriously. But of course, don't let this stop you from talking any incident over with someone. Ensure that you tell your employer and your union safety rep if there is one. Panic buttons, personal alarms, and self-defense training may help, but together they may not always be enough. Your employer should ensure that they review all your work arrangements and take steps to prevent and reduce the instances and occurrences of violence and abuse within the work area. And of course, I would just like to leave you with a little quote. Your safety is in your hands. The way you think, the way you act, the situations you put yourself in, they all determine how safe you are or how safe you stay. So before you leave home in the mornings or maybe on your way, just take a few seconds to think about your personal safety and security and what you can do to keep yourself safe in any situation.
Thank you so much, Bonica. That was very informative. I enjoyed it. Just to box back to what you said earlier about work safety culture, there's been an increase in the use of PPE, at least in Guyana that I've seen, based on the fact that we have Exxon and everything related to Exxon. And I've been most impressed by that. I'm very happy to see it, even if I'm on the corner of my village, I would see somebody wearing a reflective vest. So, it's really impressive that persons are taking their personal safety into consideration. So I'm happy about that. And I love the quote by Lamplugh, Diane Lamplugh, that said, someone can be safe once they themselves decide to be safe. And folks, it may sound like you're paranoid that while I'm in slow moving traffic, I need to pull up my window or lock my doors, like Bonica would have mentioned, but you might want to think about it again. It's better at that point to be paranoid rather than end up being hurt at some point. So always
Better
think about
to be safe
safety.
than sorry. That's what we always say.
Indeed. So good stuff, folks. We hope that you've learned something today on the World Day for Safety and Health at Work. We were looking at COVID prevention measures by Dr. Stefan Graves-Andy, and then we looked at the emerging risks at work, personal security by Ms. Bonica Gordon. They're both our QHSE officers in our sister companies. So thank you for your time. If there are any questions that you have when the video is posted, you can feel free to comment below and we will be sure to respond to any questions you may have. So again, thank you for joining us. This has been very informative. Thank you, Dr. Gravesande, and thank you, Ms. Gordon.
Thank you.
Take
Thank
care,
you very
folks.
much. Bye.